Jeanne Spurlock, Black physician and psychiatrist. Jeanne Spurlock has made significant contributions to understanding and treating the psychological stresses of poverty, racism, and sexism that impact women, children, minorities, and gays in the U.S. Spurlock was born on July 21, 1921, in Sandusky, Ohio. Her mother, Godine Anthony Spurlock, and her father, Frank Spurlock, had 7 children, of whom she was the eldest. She grew up in Detroit, Michigan, where her family moved 6 months after she was born. Like many other Americans who grew up with phrases like liberty, equality, and justice for all ringing in their ears, Spurlock had an early conflict with a powerful public institution that made her stop and think. She broke her leg when she was 9 years old, and the hospital handled her case badly. Later in her own career, she would do things differently. In 1940, after she graduated from high school, Spurlock enrolled at Spelman College. Although she had a scholarship to pay for her tuition, she had to work almost 40 hours a week to cover her living expenses. After several years, she dropped out of Spelman. She moved to Chicago and enrolled at Roosevelt University until the spring of 1943, when she moved to Howard University in Washington, D.C. In the early 1940s, Howard University had a special accelerated program leading to the degree of Doctor of Medicine. In the spring of 1943, Spurlock abandoned her plans to get a bachelor's degree at Roosevelt University and transferred into the MD program at Howard. She graduated with her MD from Howard in 1947. Spurlock had decided to pursue a career in psychiatry, and after an internship from 1947 to 1948 at Providence Hospital in Chicago, she became a resident in general psychiatry at Chicago's Cook County Hospital from 1948 to 1950. During the next year, she was a fellow in child psychiatry at the Institute for Juvenile Research in Chicago. From 1951 to 1953, she held several positions in Chicago. She was a psychiatrist at the Institute for Juvenile Research and at the Mental Hygiene Clinic of the Women's and Children's Hospital. She also started her own private practice in psychiatry. From 1953 to 1962, Spurlock studied psychoanalysis part-time at the Chicago Institute of Psychoanalysis. While attending the institute, she directed the Children's Psychosomatic Unit at the Neuropsychiatric Institute of Chicago, and she was an assistant professor of psychiatry at the University of Illinois College of Medicine. She was a clinical assistant professor of psychiatry at the Illinois College of Medicine from 1960 to 1968, and she worked concurrently at the Michael Reese Hospital as chief of the Child Psychiatry Clinic and as an attending psychiatrist. Through all these years, she continued her private practice in psychiatry. Spurlock was chair of the Meharry Medical College Department of Psychiatry from 1968 to 1973. Then she moved to Washington, D.C. to work at the National Institute of Mental Health as a visiting scientist for a year. Beginning in 1974 and continuing until her resignation in December of 1991, Spurlock was the deputy medical director of the American Psychiatric Association, and she was a clinical professor of psychiatry at the medical schools of George Washington University and Howard University. If one adds the members of all the subcultures with few resources in America, the result is a majority of Americans. Jeanne Spurlock has recognized this truth, and she has been a powerful advocate for tens of millions of Americans with few social and community resources. Throughout her career, she has helped women, minorities, children, and gays gain more resources and advocates by focusing on the special situations and needs of important American subcultures: single women, children, absent fathers, women who must play several social roles in a family, African Americans with survival guilt, children whose parents suffer from work-related stress, people with different sexual lifestyles, the never married woman, and others. Spurlock has worked to understand the different stresses and situations of these subcultures so she can develop the appropriate therapies to help them with their problems. For many of her ideas, Spurlock drew from her own experiences. She grew up black and poor, yet she became a prominent, successful woman who never married or had children. As a result of these experiences, Spurlock was to study, among other subjects, poor black children, successful black Americans who felt guilty about their success, single women, and the myths about women who never marry. One example of Spurlock's work is her attempt to help successful African Americans cope with the alienation they feel when they leave their peer groups behind and become successful in another culture. One African American automobile executive became desperate when he was caught between two conflicting groups at his workplace. When he was younger, he had been a black Muslim and had worked with the Equal Employment Opportunity Administration of the U.S. government. Then, as an auto company executive, he had to cope with a disagreement between his company's management and black workers who were protesting discrimination in hiring practices. The pressure became too much, and he committed suicide. Although this is an extreme case, Spurlock wanted to develop psychiatric therapies to reduce the stress for African Americans who are high achievers. Two of her therapies were to help her patients sort out their priorities and to suggest alternative behaviors. In one case, a patient decided that he was better off not climbing the corporate ladder. Spurlock has also helped high-achieving African Americans cope with the guilt that some feel when they become successful in another culture. Some high-achieving African Americans feel that they have abandoned people who have helped them out, or they feel guilty because their families become defensive about being left behind. Spurlock's therapies have included helping her patients to verbalize their concerns and connect them with past experiences, and she has helped her patients refrain from becoming involved in conflicts with family members about differences in attitudes and lifestyles. In honor of Spurlock's many contributions to improving conditions for minorities and women, an important fellowship for minority medical students has been named after her. The Jeanne Spurlock Research Fellowship in Drug Abuse and Addiction for Minority Medical Students is sponsored by the American Academy of Child and Adolescent Psychiatry and the National Institute on Drug Abuse. After she resigned in 1991 from the American Psychiatric Association (APA), she served as a consultant to APA's Council on International Affairs and its Council on National Affairs. Citations are in the description.